Labetalol, commonly known as Normodine or Trandate. Class for it is a beta 1 and beta 2 blocker, or it might be called a non-selective beta blocker. It is also an alpha 1 blocker, and it's an antihypertensive. That's what it does. Mechanism of action: binds to alpha and beta receptors, causing a decrease in vascular resistance without increasing cardiac contractility or heart rate. Pregnancy class for it is C. Indications: severe hypertension, typically protocol specific, but typically above systolic of 180. Contraindications: bronchial asthma, heart failure, cardiogenic shock, bradycardia, second and third degree AV blocks, kind of several of them in there. Adverse reactions: fatigue, headache, nausea, vomiting, shortness of breath, pulmonary edema, bradycardia, and hypotension. So, we do not want to give labetalol. Labetalol is very potent and causes a relatively rapid drop in blood pressure, so that's why we do not want to give this with nitro or something else that could cause a drop in blood pressure. And it also, because it is a beta blocker, it may block other beta agonists like albuterol in the body. So typically avoid those together. You know, albuterol we use to open up the airways, whereas beta, this is a beta blocker, so it can cause slight tightening of the airways. That's why we watch out with asthma as well. Dosage: 10 milligrams IV or IO push, and then repeat it every 10 minutes up to 150 milligrams if necessary. You don't have to repeat it. And if you're given an infusion, it's going to be 2 to 8 milligrams per minute typically. And you're going to titrate that to a blood pressure lower than 180 somewhere, and measured while supine typically. For the kids, we don't usually give this. Hypertension is not a real common thing for the kiddos. Onset: less than 5 minutes. Peak effects varies, and duration anywhere from 3 to 6 hours usually. We do want to watch out and only give it when the patient is supine or semifallow, laying relatively low, because it can cause a rapid drop in blood pressure. And we do want to monitor it closely for adverse reactions like that drop in blood pressure, reflex tachycardia, which we shouldn't have, but watch out for some of those adverse reactions.